Hello everyone, my name is Lizbeth, and for my topic I chose panic disorder. Imagine that you're caring for a patient who suddenly develops chest pain, shortness of breath, has a racing heartbeat, and they tell you that they feel like they're about to die. Our first thought is that they might be having a heart attack, but sometimes these symptoms are actually caused by a panic attack. As nurses, it is important that we recognize the difference while still ruling out any serious medical conditions. Panic disorder is an anxiety disorder that is characterized by recurrent and unexpected panic attacks. These attacks are episodes of intense fear that usually peak within minutes and can happen even if there aren't any obvious triggers. After having a panic attack, people usually begin to worry that they're going to have a next one and when the next one will happen, which can lead to them avoiding certain places or situations and can negatively interfere with their daily lives. Panic disorder can affect people of all ages, but it is mostly common and tends to begin during adolescence, late adolescence, or early adulthood. Children can experience panic disorder. However, their complaints are associated with either stomach aches, or they complain of headaches, or refuse to go to school because they have trouble explaining what they're feeling. Adolescents may avoid certain social situations or activities because they're afraid of having a panic attack in the public. Adults often describe sudden episodes of chest pain, dizziness, or difficulty breathing. And in older adults, panic disorder may be mistaken by a cardiac or a pulmonary condition because these symptoms, many of these symptoms do tend to overlap. So what is happening in the body? Panic disorders involve an overactive fight or flight response. Even though there isn't any real danger, the brain reacts as if there is. Research suggests that it is related to an imbalance in neurotransmitters such as serotonin, norepinephrine, and GABA, along with genetic and environmental factors. This can cause the body to release stress hormones, which increases heart rate, breathing, and blood pressure, which explains why patients often feel like there is something terrible happening to them. When assessing a patient, nurses should gather both subjective and objective information. Patients often report sudden fear, chest pain, palpitations, shortness of breath, dizziness, nausea, or feeling that they're losing control or that they're dying. So on assessment, you may observe tachycardia, tachypnea, sweating, trembling, and restlessness. One of the biggest nursing priorities is to rule out any medical causes first, because panic attacks can closely mimic conditions like an MI or a pulmonary embolism or an arrhythmia. We should never assume that these symptoms are caused by anxiety until life-threatening conditions have been excluded. Screening tools such as the panic disorder severity scale, along with a thorough mental health assessment, can help evaluate the symptom severity. It's also important to assess for depression, suicidal ideation, and how much of these symptoms are affecting the patient's daily life. When it comes to treatments, SSRIs such as sertraline or escitalopram are considered the first-line medications because they help regulate serotonin levels and reduce the frequency of the panic attacks. Patients should be taught while taking these medications that it can take several weeks for constant medication to begin to work. So they shouldn't stop taking the medications if they don't notice like an immediate improvement. For short-term symptom relief, providers may prescribe benzodiazepines such as lorazepam or clonazepam. These medications work quickly, but they do cause sedation and dependence. So they're generally used only for short periods of time or during severe episodes. One thing that I think nurse educators should emphasize is that panic disorders is a real medical condition. And it's not someone just simply overreacting. Patients deserve to feel supported and heard, and nurses play an important role by providing that reassurance and teaching patients coping mechanisms such as slow, deep breathing or encouraging medical adherence. These patients also need help recognizing when symptoms require an emergency evaluation versus when they may just be having a panic attack. So by understanding the pathophysiology and recognizing the assessment findings and educating patients about treatment options, nurses can help improve outcomes and reduce the fear and the stigma behind these panic disorders. Thank you for listening.